The next part of
Totally cheated me.
the worst chiropractor in the USA.
Even the muscles of your back are weak.
But if you haven't watched the first two parts yet, go check them out.
That should have broke my index finger.
They contain important information to help you better understand this one.
So what we need to do is find out what's turning all of this off. We're going to retest these muscles while you touch certain areas of your body. Okay, what I want you to do is find your belly button for me. Okay, this is the reflex for hormones.
This is a perfect example of the dark side of applied kinesiology.
Is the reflex for hormones.
Here, practitioners place their fingers or hands on areas that have no connection
This is the digestive reflex.
with the neuro-musculoskeletal system, such as the viscera, heart, lungs, eyes, or ears.
My immune reflex, cardiovascular reflex, my muscular reflex, and no matter where I touched, my muscles were still weak.
And draw dubious conclusions about deficiencies or health problems
It didn't change it.
Not the hormone.
Right.
that have nothing to do with your neuromusculoskeletal concern. They may even place substances on your tongue, salty, sweet, or other chemical components, to supposedly determine what your body lacks or has in excess. This is pseudo-science, and anyone claiming to practice applied kinesiology in a scientific manner often adopts this charlatan approach. On the other side of the coin, where applied kinesiology could be scientific, there's no reason to call it that, because it simply involves muscle strength tests, where resistance is applied to see if, depending on the range of motion, there is pain.
Going to re-push on this muscle again.
This latter approach should be part of the optimal practice of a chiropractor, physiotherapist, to assess which tissue component is more affected by tissue sensitivity.
Dr. Rodriguez continued his scan of my body.
Did he say scan
Continued his scan of my
or scam?
scan of my body.
Because apart from testing the reflexes of the upper and lower limbs, everything else we just saw looks more like magic tricks to distract patients and make them believe the problem lies where they least expect it, far removed from modern medicine.
Was I just incredibly frail, or was there a deeper cause to my pain? But before we were to give up, he had one last reflex he wanted to test.
This is the emotion reflex. Touch there. Resist, go. Pull. Push out, go. Push out. Massive difference, isn't it?
Certainly.
Why are you having the neck pain, the back pain, all of this?
I don't know, I guess maybe could it be like stress related or something? going on in
Emotional
my
stress.
head? Wow.
We don't need to use applied kinesiology to identify an increase in psychological and physical stressors over time, as this should be part of a proper medical history.
Wow.
These factors in your life can cloud your brain's ability to accurately assess its environment, potentially turning a regional discomfort or sensitivity into more intense pain.
This is the emotion reflex.
It's a bit simplistic to say that stress is the starting point.
Everything has a beginning, and stress is your beginning.
Instead, think of it as an additive that raises the temperature, eventually bringing the kettle to a boil, and if left unchecked, it will overflow.
Wow.
It was quite the revelation to discover that all of my physical issues came from a single source. While just knowing this wouldn't instantly cure me, it still was a relief to finally have some clarity.
And this is a crucial point for many patients. Gaining a better understanding of their pain. Studies increasingly confirm this. What matters most in relieving neuromusculoskeletal pain, especially when it's non-specific, isn't so much the therapy itself, but the initial consultation. When a patient understands their diagnosis more objectively, is provided with tools for home management, and has a clinical discussion that alleviates their fears and anxiety about a new pain, that alone can work wonders.
Dr. Rodriguez then had to reset my energy switches.
So all I have to do is reset the switches.
This would help alleviate my poisonous, stressful energy, and hopefully in turn, cure my bodily pain.
So the reset switches are here.
You already found them.
Yes.
Wow.
And I actually did feel better after this process.
Wow.
And this is the fascinating world of the placebo effect.
Wow.
But just when I thought he was a miracle worker, he hit me with some unthinkable news.
This doesn't do anything.
That's precisely why it's essential, whenever possible, to use therapies that align with the patient's therapeutic values.
When I was doing that, that doesn't do anything. Nothing.
Doing so maximizes the reduction of subjective and unique mechanisms surrounding their pain experience.
Now I didn't know what to believe.
But why do I do that? Because for some people, if I just did energy healing just the way I did, they would think I'm nuts. So I had to do this. I had to have them touch here. Touching had nothing to do with anything.
With my belief in Dr. Rodriguez at an all-time low, he made one final pitch to sell me on his vision.
I'm fixing causes, okay? I don't actually heal you because that's not the power that I've got.
You see,
I'm fixing causes.
this is clumsy but still frequently used by many chiropractors in the United States
All I do is remove the roadblocks.
who, to avoid legal action, claim that they don't heal anything.
I don't actually heal you. All I do is remove the roadblocks.
They simply unlock your body's ability
Remove the roadblocks.
to self-heal.
I'm fixing causes.
Whether the pseudo-scientific blockage is called a chiropractic subluxation,
Remove the roadblocks.
energy, chakra, solar plexus, or natural detoxification,
I'm fixing causes.
the language of charlatans may change in flavor,
Absolutely everything on this planet, from cancer to a common cold.
but it remains essentially the same.
What we want to do is we need to change our perspective. If I think it, then I am what I think I am. You want to get well? You want to get better? You need to think positive, be positive. You need to forgive yourself.
That was introduced awkwardly, but it's true,
I was looking to be adjusted, and instead he told me I need to forgive myself.
especially when it comes to neuromusculoskeletal pain. A more objective and positive perspective
You need to think positive, be positive.
will motivate patients to take active steps toward their rehabilitation outside of the therapeutic context.
Before I could get too focused on positive thinking, I had to get to the bottom of his 1-star reviews.
What we're going to do now is we're going to check for misalignments.
Before I came in, I was checking out some of your reviews.
No, I don't normally go on and take a look
Yeah.
at those reviews. You're going to feel a quick tap here.
And is any of this going to result in a crack?
You potentially could be creating a problem for this patient.
And it's an excellent therapeutic crescendo with a false manipulation of a non-existent spine misalignment that I will address in the next segment. The link should appear now. In the meantime, share your story, comments, suggestions, or just let me know if you have any more questions.